everyone's here now. We're all set up. We've had some minor technical issues, but we think we're all sorted. So welcome everyone. My name's Anne Evans and I'm the President of the Australian Population Association for another couple of weeks. So I would like to welcome you all to this final session in our seminar series that we've been having this year in lieu of our conference, which is the main event that the association has. Of course, in this, unprecedented times, we've had to make changes, and our conference organising committee have organised a really exciting environment series of seminars and sessions that we've had over the past couple of weeks. So today is the final session, and today we are welcoming Dr David Gruen from the ABS to talk about data and COVID-19, in particular the way that the ABS has responded to changing demands for data. Sorry.
It's a good Freudian slip.
Yes. Demands for data, which of course are always demands on David and his time and his team. So I'd like to start by acknowledging the traditional owners of the lands on which we meet, the Ngunnawal and the Ngambri people, and pay my respects to their elders past and present. And I acknowledge all of you out there watching remotely from whatever lands that you may be sitting on. So as I mentioned, Dr David Gruen is with us today. David has been the Australian Statistician for nearly 365 days or so a full year. As the agency head of the ABS, he's accountable for the functions and operations of the entire Bureau. David has had various senior roles in the Commonwealth, in the Department of Prime Minister and Cabinet, and in the Australian Treasury. He's also worked for the Reserve Bank and in the Research School of Physical Sciences here at the Australian National University. David also had a Fulbright postdoctoral fellowship, which he took up as a visiting lecturer in the Economics Department and the Woodrow Wilson School at Princeton University in the early 1990s. So he's had a very varied and distinguished career. He holds a PhD in physiology from Cambridge University and an economics, a PhD in economics here from the Australian National University. So I'd like to welcome you, David. Thank you for taking time to come and present to us about all of the challenges you've faced this year.
Thank you very much. Unfortunately, we're doing it online.
But not online face-to-face interview.
No, I don't think we've done that. Yeah. So, I mean, are we good?
We're good.
We're good. So what slide are we on? 2?
It's the slide 2, yes.
Yeah, okay. So I think I've talked about that, and let's move to slide 3. So I've talked a little bit about this, no face-to-face collection, and then the other thing which was an issue both for businesses and households was reduced response rates. So if you, particularly for the labour force survey, we usually enrol people for their 8 months in the survey in the first month face-to-face, and if you can't get to them face-to-face, the proportion of people who sign up is significantly reduced. Once you sign people up, they're more than willing in most cases to either do telephone interview or on the net, but the face-to-face at the beginning is important in getting them into the system. So we had to, as I said, we had to pause some surveys that relied on face-to-face, and then kind of because of the unprecedented nature of some of the changes that occurred, that led to all sorts of conceptual issues to do with, well, first of all, trend series we stopped producing trend series because trends don't make much sense when you have enormous jumps in series. So we stopped trend series, and in some cases we even had to stop seasonally adjusted series. So move to slide 4. This slide shows some of the new products that we produced. One of the first things we did was to decide that, given that circumstances were changing so quickly, that there was benefit in putting in the field small surveys of both businesses and households that would generate results quickly. So in the case of the business survey, we'd never done this before. We put a survey in the field, collected the first data on the 16th of March and published the results on the 26th of March. So we collected for 3 or 4 days. We had planned to collect for 2 weeks, but we collected for the first week, and then enormous changes to the economic environment happened because all the social distancing, all the really strict rules came in on about the 23rd. So we just stopped collecting because the second week would have been totally different from the first. So we collected for 4 days. We had about 1,200. We collected data from about 1,200 businesses, and we published the results on the 26th of March. And then we had a cycle where these small surveys were run at least monthly in order to monitor how businesses were responding to the changed circumstances. These were quick surveys. Initially, they were the question. It's a short survey. It could take 5 minutes to answer in many cases. And we were interested in how many people were working from home. You can imagine, given how big the changes were in the economy, that just getting results from something like 1,000 businesses or 1,000 households, you get a much better sense of what's going on, even though it's not of the statistical quality of most of what we do. And there was enormous response from government and the community for the fact that we were actually doing this. And quite quickly we were connecting up with government departments and the Reserve Bank to change the nature of the questions. As the nature of the crisis evolved, we evolved these surveys. So we weren't after a long time series with exactly the same questions, which is obviously what you do for something like the labour force survey. We were after quick pulse surveys, if you like, to try and find out what was going on. One of the most extraordinary things, which will be a model for a lot of the things we do in the future, the single touch payroll data, the tax office interacts with most businesses in Australia via single touch payroll. So any business, just about any business with employees, when it runs its payroll, it sends the results automatically to the tax office. So there are now slightly more than 10 million employees in this database. They're paid at different times because companies decide, whether they pay on a fortnightly frequency or a weekly frequency, and the dates are all different. But in early April, we got access to this data. So just to give a sense of scale, the labour force survey is one of the biggest surveys we run. It's about 50,000 individuals. Single touch payroll is just north of 10 million. Now, it's not the same coverage because if you're self-employed, you're not part of the single touch payroll database. But if you want to cut this data in a whole lot of different ways, whether it's regional, by age, by industry, obviously with 50,000, you can cut data only so many ways. Whereas with slightly more than 10 million, you can look in extraordinary detail at what parts of the country are suffering in terms of job loss in a way that you just can't with a much smaller survey. So the other benefit of the single touch payroll data is that we publish it 17 days after the reference period. So it's being published fortnightly, about 4 or 5 weeks faster than we publish labour force surveys. So it's a gold mine, and we are continuing to kind of think of ways that will improve the quality of this data. The other thing we did was come up with a whole bunch of preliminary and provisional publications, simply because some of the movements in series were, to use the most popular word in 2020, unprecedented. Some of the series were did things that were just completely off the scale, like retail trade. And so being able to publish provisional data, in the case of retail trade, you can publish based on 80% of the sample 2 or 3 weeks earlier. So we started doing that. And then we went looking for data sets that people would like to have access to. I'm going to talk about some of those because of the kind of extraordinary nature of what was going on. We also did interactive maps and of a bunch of things. So age and health character conditions. So in the early parts of the pandemic, it's useful to know where are people over 60, where are people over 70, what about comorbidities? So we published all that data on interactive maps. Where do people who work in the health sector, where do they live, all that sort of stuff. And then the other thing we did was make it easier to get access to our micro data. So we stopped charging for things for a while. My attitude was, this is a set of circumstances where the ABS can demonstrate just how useful we can be, and we're not going to be slowed down by things like charging. Now, obviously, you can't do that forever, but you can do it for a while, and you can demonstrate just how useful these are. So we did. So in the early part of 2020, we introduced these new products without charging for them, and just basically did it, and got an enormously positive reaction out of the community and the government for doing so. So now let's move to slide 5. And now we're beginning to talk about some of the data that's relevant to population. So one of the new products we produced was the regional internal migration estimate, provisional regional internal migration estimates. There was a competition, we never actually ran it, but there was a competition inside the ABS to come up with the best acronym. So PRIME is one of those acronyms, and there were several others that were invented as part of this process. So this gives you information on provisional, on internal migration between states and territories and the greater capital city statistical areas in and out of them. And it isn't true of absolutely every series we produce, but for an extraordinary number of them, there are just things going on that we just haven't seen before, or haven't seen in the lifetimes of many of the people who've worked in the ABS. Then we produced provisional overseas travel statistics, and one of the ones that I think has been particularly interesting is the provisional mortality statistics. So I'm going to talk a bit more about those. So I won't tell you about them until we get to the chart. So on overseas arrivals and departures, we ran feature articles on international students. I'm sorry, on slide 6. We ran feature articles on international students, detailed state breakdowns. We had to get rid of the trend from February and the seasonally adjusted data from April, again, because of the unprecedented nature of the data. And then it becomes extremely important to do more frequent revisions to net overseas migration, given what has happened to net overseas migration. And as the economy recovers, we're going to have to think carefully about how to deal with net overseas migration, just because historical patterns have changed so radically. And then on 7, we have improved, we've made it easier to get access to the microdata, which is a big deal for people who are trying to do detailed statistical work. Slide 8 is a log scale. So overseas arrivals has a gentle upward trend. So the two series here, the blue one is short-term visitor arrivals and the red one is short-term resident returns. And it's a log scale, so it's more than 2 orders of magnitude. 2 orders of magnitude. How many economic series do you see that change by 2 orders of magnitude? It's like physics. It's not like demography, right? If something was to change by 50%, that's a huge deal. These things change by 99.8%. Just extraordinary. So, as you can see, if you plot this linearly, it just falls to 0. You can't even see that on a scale where you can see most of the chart, the rest of it is just nothing. So, we know this, but it is kind of pretty unprecedented. So, we moved from on this data, we moved from numbers that are in the million, small number of millions, to numbers that are a few thousand in the space of a month or two. So that's overseas arrivals. The next slide, slide 9, shows so this this is tracking, you've got a year's data and you're just tracking forward, so you haven't yet seen the full impact of COVID-19 because the latest year in this data still has pre-COVID data in it, which is why it doesn't look that big. But it does give you a sense. If you look at all these other events, which were a reasonable deal, like the global financial crisis, the Asian crisis, various other things, the movements once again are kind of tiny on the scale of what's been happening as a consequence of this. The next one, which is slide 10, shows capital city migration. And so you guys may pore over this data, but I don't. And so I'm not aware that, I mean, I guess if I think about it, I know that there's a net internal migration away from capital cities. But it is again interesting that compared to the historical period, by June 20, we're talking about net internal migration away from capital cities was the order of double what it is normally, right? So again, this is just generating huge changes. Slide 11 is the provisional mortality statistics. So let me just tell you a little bit about that. The ABS traditionally publishes mortality statistics after we have, so you have doctor certified deaths and coroner certified deaths. And not surprisingly, getting access to coroner certified deaths takes a long time. So our normal pattern of doing things is that we publish annual mortality statistics about 11 months after the end of the year. But if you're willing to focus simply on doctor-reported deaths, which captures about 85% of deaths, then you can report them 2 months out, and you will have captured 85% of what will ultimately be all the deaths in that period. So we started doing that earlier this year, and I don't know whether you can see this, but the blue band is the range of so there are about 2,500 deaths in Australia per week, and it rises in winter largely because of flu. And interestingly, so what we've got in this chart is a picture of COVID-19 new infections, and we added that picture because something interesting seemed to be going on at the end of March when the 2020 deaths were well above the range of the previous 5 years, and it coincided with a peak in the COVID-19 infections. So we thought that was interesting. We weren't sure we knew what was causing it, but nevertheless we thought it was interesting. But something completely different has happened in the second spike. So in the second spike, which is predominantly Victoria, where the COVID-19 new infections are significantly higher than they were in the first spike and lasted for longer. During that period, through the whole period, aggregate doctor-reported deaths are lower than the average of the previous 5 years, and for some, it's lower than any of the data outcomes in the previous 5 years. So the international discussion is all about how big are the excess deaths from COVID-19, because not every death gets coded as COVID-19, and there are other things that can kill you. Other things. It looks like, if you look at the US data or the British data, excess deaths are really a long way above COVID-19 deaths. And there aren't many countries where excess deaths are negative, but we are one of them. So Norway's another. And why would you have negative excess deaths? Well, you don't have to think about it for too long. First of all, it's a situation where COVID deaths are pretty low. And the second is you have encouraged a whole lot of people to get flu vaccines, and there's all the social distancing. So you have cut short you've basically not eliminated the flu season, but you've very substantially reduced it. So it looks like, and the numbers are not big enough to matter for demographers, in the sense these are really small changes, but they look to be statistically significant, and it does look like we've got less deaths. And there's all sorts of interesting things, because one of the fears is that people are not going to the doctor and therefore they're not getting proper treatment for chronic diseases. And also there are questions about whether there are mental health implications from lockdowns, and all of that's legitimate. But interestingly, the effect that's dominating at the moment is the fact that we're managing to stop so much flu. And that's reducing aggregate deaths by enough that even, so remember, there were quite a lot of deaths in Victoria during this period, but not enough to drive the aggregate numbers above the average of the previous 5 years. So I reckon that's pretty interesting. Population growth, well, I think you all are aware that net overseas migration, we're going to show that in the next slide. So now we're doing slide 12. So population growth is going to be something of the order of 0.5%. And that's, well, it's not unprecedented, but it's pretty close. And the reason for that is predominantly that we're moving from a world where net overseas migration is of the order of a couple of 100,000 to a world where net overseas migration is about minus 70,000, something like that. So that's a huge change, and that's the thing that's going to make the most difference, right? The decline in deaths isn't big enough to make a big difference, and if there's a change in fertility again, it's not the magnitude's not big enough. It's nothing like as big as the magnitude of the change in net overseas migration. On fertility, I think that most people think that that we will see a decline in fertility as a consequence of the heightened economic uncertainty of the pandemic, and certainly the modelling that Peter McDonald did for the population, for the Treasury Population Centre, has got that assumption built into it that there will be that fertility will fall and then recover over the next couple of years. I will be very interested to see what the outcome is, and the reason I'm sceptical, and that may well be the outcome, but I'm sceptical for that. There are a couple of things that are different about this downturn than previous downturns. One of them is that the size of the government stimulus is so large that we have seen quite substantial increases in household disposable income, which are completely unprecedented in recessions. You do not expect to see, in a situation where lots of people are losing their jobs, to see strong growth in household disposable income. The last 2 quarters have seen stronger growth in household disposable income than any time in the last 8 years. Now, what people are saving largely, but in a world where that happens and then we get a vaccine and things return a bit to normal, I would be very interested to see what happens to fertility. And I'm reserving judgment. I mean, as we all know, forecasting, especially about the future, is tricky. And so nobody really knows. But this is sufficiently different from other downturns I've seen. Like, let me give you another statistic just to give you a sense of it. JobKeeper is the biggest package ever in the Australian government has provided to anyone. The second largest package of all time is another package in this downturn, which you probably haven't even heard of because it gets so little. It's called cash flow for businesses, and it's the second largest package in the history of the Federation. And the amount of money spent in by JobKeeper up to and including the September quarter is 70 billion. That is by a reasonable amount more than all the spending in response to the global financial crisis. These are enormous packages, and they have cushioned the effect on people of the downturn. Now, people have definitely lost jobs, but I just wonder, as jobs come back, just how much difference it will make to fertility. We all get to play. We all get to see in hindsight, and we'll all be wise after the event. But as we sit here, I will be very interested to see actually what happens to I won't be surprised if the effect is smaller than demographers I'm currently modelling. I'll probably turn out to be wrong, but that's fine. Next slide is 13, which shows you natural increase hardly changes, but of course net overseas migration moves from over 200,000 to -70, and therefore it does dramatic things to population growth. So coming out of the crisis, there are going to be new questions and new challenges for a data supplier like us. We're going to want to know more about the causes and consequences. And one of the things we're doing is ramping up some of the work we're doing on microdata. Again, this is not demography, but we are integrating JobKeeper, JobSeeker, single touch payroll data in order to be able to watch transition. And this is all done in a de-identified way, of course, but we will be able to identify individual transitions in and out of work and what payments individuals are getting. And we're in a world where data is now much more, you can do much more granular things than you could previously. Next slide. Okay, sorry, that's slide 14. Apologies. Okay, let me stop there, and I'm happy to take questions on what I've talked about or anything else for that matter. Having appeared before Senate estimates, I'm good at avoiding questions I don't want to answer.
Okay, questions from the floor. I'll direct the leaders monitoring the online questions if people have questions there. So I'll go to Terry first and then Liz.
Thanks very much. It's really interesting to see these trends, and I've appreciated the ABS getting the data to us very quickly. Can you tell us something about the plans for the census next year and how these changes might affect the census?
You mean COVID-19 or?
Your changes in the way you're collecting and presenting data.
So, I mean, the census, we're obviously hoping that, so the census is, for those who don't know, will be the 10th of August. And it'll be a predominantly digital census. We're obviously in a world where we hope that by then there's enough vaccination that we're not going to have kind of serious outbreaks. But we're certainly prepared for a situation where we might have outbreaks. We ran an operational readiness exercise through October and early November across 100,000 households across Australia, some of which was in Victoria. And so we had to do different things, much less face-to-face contact in those places. And so we are prepared if we're in a world where there are some communities where there's an outbreak. We're prepared for a world where we might not be able to go to everybody's door and knock and have face-to-face contact with them. That in a sense is, that's something we have to kind of prepare seriously for, but hopefully by August things will settle down a fair way, given that the UK's already the Pfizer vaccine is already being given out, or will be next week in Britain. So we're imagining that those things are not going to be a big constraint on the census. But we're kind of ready for whatever happens. Much of what I've been talking about will not impinge on the census. So the census, I mean, obviously to the extent it's electronic, the data captures easier. But I think the census is largely continuing on in parallel with all this other stuff.
Thank you, Liz Allen from the ANU. Just wanting to follow up on that question from Terry, is that the Bureau has demonstrated the capability of working with more non-traditional data sets and so-called big data.
Yep.
I wonder then, given the UK move toward perhaps leaving the traditional census behind, How soon will the Australian Bureau of Statistics follow that and move to more of a rolling population survey and administrative data to fill the gap?
So ultimately, it's a call for government about the model that we would use. But we'll have a serious think between this census and 2026 about what we're going to do. One of the things that has become clear to me in the period that I've been in the ABS is just what a big complicated thing the census is, not surprisingly. It's a $500 million exercise. And how complicated it is in a world where you can imagine lots of the complications arise from the requirement to have an extremely secure digital service and the fact that it attracts cyber attacks. Because you can imagine that it's a kind of feather in someone's cap if they can disrupt any country's census. So an enormous amount of effort has to go into making sure that this thing is secure and making sure that it, and especially after the experience of 2016, doing everything we possibly can to make it a smooth experience for people online. And we're in a world where more and more people want to do it online, they don't want to do it on paper. So who knows what, all of the fuffle about voting machines in the US, who knows what implications that will have in the longer term about people's trust. I mean, these things first happen in the US and then we get them as an echo. And so I don't know the answer to that, so that's a long way of saying that we will have a serious think about how we will run the 2026 census, but we won't have that serious thing quite yet. But the idea that
You've already started preparations for 2026.
Sure, that's right. But the idea that big data sets can provide complementary evidence and therefore might enable you to do things differently, I'm definitely sympathetic to that perspective.
Okay, Edith, you've got something.
Okay, I have a couple of questions from online. The first is from Patrick Core, previously from the ABS. Is ABS considering publishing weekly or monthly provisional birth registrations and perhaps birth notifications by the National Perinatal Collection?
Good question. Does anybody know the answer to that?
Not at this stage.
That's a good answer. Denise Carlton, for those people who can't see.
So with a lot of these things, we haven't thought about that at this stage.
Yeah.
But as the pandemic progresses and the impacts of the pandemic progress, we look at new things come online. So we're not expecting to do that at this stage, but it doesn't mean that we will. Did Pat ask about weekly?
Yes.
I think
What about hourly?
I think weekly is very unlikely.
He said weekly or monthly.
Yeah, certainly not weekly. Monthly is, as things progress, if we think we're starting to see changes, it's possible that we would look at some sort of provisional number as we have with the other component. But we're not there yet.
So the data's not changing.
We don't
Okay.
And it's also too soon. It's now coming to the point where it's starting to be relevant, but it hasn't been yet.
I was wondering about hooking up. I mean, people presumably do all sorts of, I collected this data, but I'm kind of interested in it. You know, there are a lot of things you do before you actually give birth.
That's right.
You go to prenatal classes, you do all that sort of stuff. In a sense, you could find out whether those people are seeing unusual demand or relatively little demand. But it's complicated because to the extent that people are in lockdown, they might well be doing it virtually rather than ringing up a paediatrician, a gynecologist.
You've just done a discussion part of the paper that we're just working on. So
Yeah.
anyway, lots of interesting data there.
And there's a question here from Alison from the South Pacific Commission. If you had to nominate one indicator that could best demonstrate the economic impact of COVID-19, what would it be? Or what admin data set should the most effort be put into to get timely data?
So I think single touch payroll in Australia it's both extraordinarily timely and it's extremely rich. And we've only scratched the surface with what you can do with it. And I think in terms of economic effect, the labour market's the place where the most important things happen, in the sense that if people are losing their jobs, that really matters. I mean, GDP is a kind of good summary measure of economic activity, but to the extent that people are losing jobs or losing livelihoods, that's a huge deal. So I think single touch payroll, but likely I don't have to limit myself to one. It'll be a lot of things.
Any other questions from the floor? James.
James Ramer, also thank you. Very interesting presentation. I like to think of COVID-19 in a demographic sense, especially lifestyle migration, as a turning point. I think we're not going to go back to the way we were. But I'm wondering if what you think of in terms of your organization or your government departments, if this is instigated a turning point in the way you need to produce statistics. Are there going to be I guess what I'm asking is, what are the long-term implications of COVID-19 for ABS in terms of its practices?
So the answer to that is that we will, I think, continue to provide a portfolio of statistics, both high-quality statistics that take a fair while to produce, which we've always done, and faster statistics, which are smaller, based on smaller samples, and therefore have higher standard errors, but you get them out quicker. The premium on such statistics was particularly high in the middle of the pandemic, and so it may well be that we don't do as much of that if you look forward to beyond the pandemic. But I think that will continue to be something that we do much more than we did in the past. There will be the capacity to run fast surveys and produce things quickly. And the other thing that I think this has turbocharged is getting more big data in the door and finding ways that will complement surveys, and in some cases enable you to have smaller surveys, because the survey can then fill in the gaps that the big data doesn't have. But you can probably reduce sample size in some important cases, and you probably can reduce the length of the survey, because you don't have to ask a bunch of questions you already know the answer to.
Okay. I turned my microphone on after all of that. I forgot before, but that was a bit loud, so I think I'm going to turn it back off. So I'd like to thank you, David, for coming and sharing that information. I think we've got access to data in a very different way than we had even a year ago, and partly that's just the ongoing work that's happening at the ABS and other places, but also as a result of the pandemic. And I think it's really interesting to see how you've been responding to this, and that some of those graphs are really, really exciting from a research point of view, but challenging from a human point of view as well. Sure. So I think there's a lot of really exciting work that's going to be done over the coming years. So also I'd like to apologise for our equipment. We've got this flashy new building, and obviously we couldn't get it to work. But we got there in the end using old Zoom technology, which we're now all very, very used to, but we couldn't quite get the two modes working at once. But thank you all for coming as well. I'd like you to join me in thanking David for a really fantastic work. Before we go, I'd like to remind you all that this was supposed to be a conference. The conference didn't happen. The conference will be happening in 2022. It's a little while to wait, but in the meantime, if you can join up to the APA, those of you online who aren't members, and keep in touch with what's happening. The organising committee for the conference put this series together. I'd like to thank Edith Gray, James O'Donnell, Brian Hall, Denise Carlton and Tanuja Doss for being members of that committee who have to organise organise a conference, then convert it to a non-conference in a very short space of time. So thank you all for your work on that. And also to Anna and Wandos for providing the behind the scenes work and for sterilising the microphone between questions. So thank you all very much. Have a good afternoon.